So I see we have folks already logging on. Thank you so much for being with me tonight. I am Dr. Kimberly Smith Dotrieve. I am here in place of Dr. Rita, and she shall be back with us next week. No, nobody can really replace her, but I will try my best to impart some information to you. So just a little history here. I have been seeing so much stress, so much anxiety, depression, psychological issues going on with people. And of course, it's because of everything that's going on in our world today. So we have so many people who are stressed. They're stressed about COVID. They're stressed about their family members potentially getting COVID. They're stressed about people they may have lost already, people they're concerned about who are in the hospital and they don't know if they're going to make it or not. But also the economical issues. People have lost jobs. People have had reductions in their pay. There's so much going on in our world today. And let me tell you, I don't know where your faith lies, but I will go on the line saying, with everything going on, please have your own relationship with God, because that is very, very important, especially when you're dealing with these day-to-day issues. We have to figure out how to get beyond the stress that we're feeling, because believe it or not, that stress literally is changing what is going on inside of our bodies. And that change can actually be a change that is detrimental to us. So very, very important for us to figure this out. Very important for us to be able to get our stress under control, because this is what it's about. Stressors are going to come. We cannot control the stressors that come our way. However, we can control how we respond to those things. So personally, my way of dealing with it initially is to not deal with it. I don't have to react. I want to properly respond to issues. So if something goes on and it rattles me, I typically will try to take a step back and not say a word about it, give myself a moment to kind of replay it in my mind. To be perfectly honest, is actually giving God some time to talk to me and say, okay, my child, now you're going to be representing me. So please do me good. And after I have that little talk with the Lord, then I feel better. And now I can go back and revisit the issue and give a response that is not emotional, a response that is hopefully going to be helpful for the both of us. But reacting is what leads to what we're going to talk about tonight. So again, I've had so many patients who've come in with stress and anxiety. One patient in particular, 50 years old, chest pain, shortness of breath. She's been to the hospital multiple times, and every time she's gone, she's okay. And I mean, she's gotten to the point where her EKG is abnormal, her blood work is abnormal. They take her to the cath lab, and lo and behold, she really doesn't have any blockage going on. And so it had me wondering, okay, what in the world could be going on with her? And I was reminded about this syndrome, Takasubo. So Takasubo syndrome, also known as broken heart syndrome, is a real thing, a very, very real thing. So let's go through this case study here. So this is a case study that I actually found in PubMed, and it's of an 81-year-old woman with sudden onset chest pain and shortness of breath. So she goes to the emergency room, and a workup is started, and they find she has really high blood pressure. Her heart rate is up. They do an EKG, and the EKG is abnormal. They do blood work on her, and her cardiac enzymes are also abnormal. They're high. So cardiac enzymes Those are levels that we can check in blood work that let us know whether or not the heart is actually irritated. So all of these things are abnormal. So of course, her diagnosis right off the bat is acute MI, or better known as a heart attack. And so let's hurry up and get her to the cath lab. She has to have some kind of artery that's blocked severely, but get her into the cath lab and she really doesn't have blockage to explain the symptoms nor the blood work. So what they did find was this. So this here is a ventriculogram. So what happens with the ventriculogram is the cardiologist will go into the artery. Usually they'll go into the groin, but now they have better techniques where they can go using the wrist. But they put a probe all the way through to the heart and they're able to inject dye there. And when the dye is injected, they're able to see the formation of the ventricle of the heart. So for those of you who are not really familiar, when you think of your heart, the heart has 4 chambers, 2 at the top called atria and 2 at the bottom called ventricles. So the one you're looking at now, this is the ventricle on the left side, and it's the ventricle that's responsible for contracting and pushing the blood out into our body. So when they did this ventriculogram, this part that's right here that's really narrow is representing the base of the heart, and this part here that's ballooning out is the apical part of the heart. What should be seen is a nice symmetrical flow of the blood through and through. We shouldn't see this narrow part right here. So here we can see a normal heart and you can see the blood flowing through and through, as opposed to the one we just saw where there's this narrow part here at the base and the rest of it balloons out. Well, what we're looking at here is this part that's ballooning out is actually the part of the heart that is not really moving. This part, the wall of the heart, is having an issue contracting. So it's just kind of sitting there. Now there's probably a little bit of a contraction, a little bit, but it's not that strong contraction that you're seeing up here at the base. So this is what we see in a ventriculogram in a person who has Takotsubo or broken heart syndrome. And that is what actually is able to give us a definitive diagnosis, because based on the blood work and all the other signs and symptoms, you would just think, if you're a cardiologist or the ER doc, you would think that they're just suffering from a heart attack. But the angiogram says, nope, all the coronary arteries are clear, or they have a little bit of blockage, so it doesn't explain what's going on. But the ventriculogram is the study of choice, and it will show you this picture right here. Now, Takotsubo, where did it get that name from? Well, here you go right here. This is a Takotsubo vase. It is actually an octopus trap. It was the term was coined in 1990 by the Japanese. They were the first ones to actually describe what happens in people who have broken heart syndrome. And so, of course, it was given that name because of where it originated. So the clinical features of Takotsubo syndrome or broken heart syndrome is pretty much that a person will present to the emergency room with classic heart attack symptoms. The heart muscle is weakened. So we're looking for a strong contraction. But instead of seeing that strong contraction throughout the muscle of that ventricle, you see that again at the base, it's strong, but the rest of it, the wall of it, is very weak. And so you get that ballooning out of the rest of the heart as it feels or as it tries to push the blood out of the heart into the rest of the body. So this is happening in 90% of perimenopausal women, believe it or not. 90% perimenopausal women. So you're talking about um, 45, 50 years old on up. That is mainly where this diagnosis is seen. The ejection fraction, when I talk about that, I am talking about the ability of the heart to contract and push blood out into the rest of the body. Because remember, the heart is our pump. All of the fluid that we have in our body is going to be pumped through the heart. Well, the ejection fraction normally is about 55 to 75. Whenever you do an echocardiogram, that's typically what you see in somebody who has a normally functioning heart. Well, those who have broken heart syndrome, their ejection fraction has been seen to be as low as 15%. But the good news, it is actually usually a transient thing, meaning at the time when it's diagnosed, it is you have an ejection fraction of about 15%. But over time, that heart muscle recovers, and it might take days, it might take weeks, it might take months, but typically you're going to see restoration of that heart function. If the person can get their stress under control, and if the person doesn't continue to have stress day after day after day, that is going to again attack the organs, especially the heart in this case, and cause it to fail again. So 1 to 2% of heart attack cases, MIs, or myocardial infarcts, or heart attacks, 1 to 2% of those cases are actually Takotsubo syndrome. And it's because it's hard to differentiate between the two until that ventriculogram is done. It can also be seen when you do a regular echo as well, because you're able to see the motion of the heart muscles with an echocardiogram. But what is the cause? Extreme stress, whether it's emotional, whether it's physical, whether it's both. Stress. So I know this is a busy slide, but I wanted to make sure you had an opportunity to take a picture of it if you wanted to, because these are just really good. This is good information. So there are many different things that cause stress. We're really focusing on the psychological portion, the psychological aspect of stress and what it can do to our bodies. So from a psychological standpoint, we have mental stress. We have things that come at us every single day. I explained to a patient earlier today, I can change your medication. I can add something to what you already have. But at the end of the day, what typically I've been seeing is patients will feel so much better for about 2 weeks, maybe 3 weeks max. And then they start to just tumble down again, because unless we're taking care of our response to stress, we really haven't solved anything. You can take antidepressants, you can take anti-anxiety medications. They may help initially, but what they don't help is the stressors that continue to come at you. And when it already feels like your plate is full, bam, doesn't it happen all the time, where there is just another thing that happens and then it just throws everything out of whack? Well, when that happens, our sympathetic nervous system and the hypothalamus pituitary adrenal, or the HPA system, is activated. And what that means is there are substances that are produced in our body that are going to go out and initially try to protect us. That's initially what happens when we're under stressful situations. The initial response from our body is protection. So the body's going to produce substances, catecholamines, glucocorticoids, which another name is steroids, which are meant to be protective. With the catecholamines, these are things like adrenaline or epinephrine, dopamine. Those are words you've probably heard before. But these are things that are released so that we can be ready for our fight or flight to kick in. So that's where that increased heart rate comes from. That's where the increase in your blood pressure comes from. Those things are actually meant for you to get ready to fight or for you to get ready to run away, whichever one you choose to do. But what happens when you're stressed for long periods of time? Well, these things are hanging around for way too long. They're hanging around for a longer period of time than we wanted to. So we go from it being beneficial to being an adverse thing when stressors have us feeling stressed for extenuated periods of time. And so those actual items that were meant to protect us end up flipping and causing more harm than good. So the catecholamines initially, when they're released, they'll increase your heart rate and your blood pressure, getting you ready for the fight or flight. But if it happens for too long and they're hanging around for too long, well, it increases pro-inflammation markers. They're causing higher levels of interleukin-6 and CRP, and those are things that are going to be detrimental to our organs. With the glucocorticoids, the steroids, prolonged activation of that pathway makes the glucocorticoid change from being an anti-inflammatory to a pro-inflammatory product. So you see what's happening. We have things in our bodies that are set up to protect us initially, but prolonged periods of stress will make those same things that were supposed to be protective turn into things that can be detrimental to our body. Now, I put the physiological on here as well so that you can see. Whenever you have like actual damage to your body, you're in a fight, you're in a major accident, you've hurt your body, the structure of your body. What happens with that stress is that we actually end up seeing very high levels of the interleukin-6 and CRP. And I wanted to add that in here to let you see that when the catecholamines are hanging around for way too long, that's what we also start to see. And so that's where the inflammation comes from. So what does this mean? This means that stress, when you just have a stressor and it's dealt with, your body is in protective mode. But when you have a stressor that goes on and on and on and on, well, those things meant to protect us end up being things that can be harmful to us. We have to get our stress under control. Uncontrolled stress causes chronic inflammation throughout the body and will ultimately lead to organ damage. So you think of stress like you're not thinking of stress in such a way that it can truly be harmful, but it actually can be harmful. Takotsubo is seen in so many older people when they lose their spouse. They've been married for years and years and years. One of the spouse dies, and usually you will hear the story that the surviving spouse dies soon after. That's a part of broken heart syndrome because the stressors are there and it's a everyday in and out phenomenon where these substances that were meant to protect us end up hanging around for so long that they become detrimental. And so you see that a lot in people also who have just chronic stressors. They have these jobs, they're high demanding jobs. These folks are working 18 hours a day, 7 days a week. And what happens? You hear about them having a heart attack. You hear about them dropping dead. You hear about them having strokes. These are chronic inflammatory cases where they've been stressing their bodies for so long that the body can no longer protect itself. And these substances that were meant to protect have now become dangerous. And now they're starting to mess up the blood vessel and cause leakage within the blood vessel and causing plaques and buildup in the blood vessel that ultimately leads to blockage and heart attacks. Same thing can happen within the brain. Same thing can happen to any of the organs within our bodies. But what is the problem that we have with controlling our stress? Well, number one, we've never really been taught that stress was detrimental. Over the course of the past 10 years, probably we've heard more and more about it, but I don't think people realize the extent to which stress can be detrimental. So hopefully this is, really falling on plenty of your ears, helping you to understand how stress can truly, truly be something that leads you to an early grave when it doesn't have to. We have to ask ourselves, why do we have to react? Why can't we respond? Why do we have to let other people control our emotions? Because really and truly, that's what it ends up being. Just because somebody comes at you, even if they're coming and cursing you out, why do you have to respond in the same manner? So think about it from this standpoint. Really and truly, we've been groomed to respond. You're not going to let anybody talk to you any kind of way. Oh, the family and the friends are all around you, just egging you on. Oh, I know you're not going to let them do that. I know you're going to tell them off. I know. But really and truly, think about what happens when somebody makes you mad and when you are stressed about a thing. Think about how long that stays with you. So it happened at 8 o'clock this morning, and it's now 8 p.m. tonight, and you're still mad about it. You're still in your mind thinking about, oh, I should have said this and I should have done that. All of that has those catecholamines and those steroids just rolling through the body. Now imagine living a life where this is happening day in and day out, and the effect that this is going to have on your organs. So we now know that this leads to chronic inflammation. We also know that chronic inflammation is truly the source of the majority of our medical issues. They're starting because of inflammation. What can we do? Preserve your peace. This is my absolute favorite motto. If anybody knows me, I say it probably every day, because there's going to be something that comes at you day in and day out to disturb your peace. But you don't have to be a part of those things. You can make a decision to not deal with it, because now that you know those stressors lead to lingering substances within our bodies that can damage our organs and lead to heart failure and other organ failures. Now that you know that, you should understand how important it is for you to be preserving your peace. So now, can CBD help? Because we are all here because of these wonderful, wonderful CBD products that Wakana has to offer for all of us. Can CBD help? Well, for one thing, we know CBD is a very strong anti-inflammatory. So the answer to that question has to be a resounding yes. Absolutely, CBD can help. CBD has very, very strong anti-inflammatory properties. So when you think about CBD, think about that. Think about it being able to reduce the inflammation. So if we can have a reduction of the inflammation that's going on throughout the body that's caused as a result of stress and the substances that these stressors are allowing to just linger in our bodies for way too long, then we know that the anti-inflammatory effect of CBD can be beneficial. So these are this is actual information from different studies that are looked up that show how beneficial CBD can be. So CBD will improve the ability of receptors in the brain to respond to serotonin, causing less depression and anxiety. So the big thing that happens when you're really stressed and you're really worried is that your brain starts to suck up the serotonin. And the depletion in the serotonin within the brain leads to some extreme episodes of depression and anxiety. Well, CBD can help in a way where the receptors respond in a positive manner to serotonin. So the receptors, I want to say in a way, they're hypersensitive to the serotonin. And because it is allowing the receptors to respond in a positive manner to the serotonin, it's not sucking it up as quickly and is not depleting our brain of serotonin. So when more serotonin is allowed to hang around and the receptors are responding to the serotonin in a better fashion because of the CBD, you have less depression and anxiety. What else does CBD do? It will protect the blood vessels from damage. So we know that constant chronic inflammation is going to cause damage within the blood vessel. And as that damage is occurring, that's how plaque forms. And the longer that inflammation is there, the more chronic that inflammation is, the more accelerated blockage formation occurs within the blood vessels. CBD protects the blood vessels against the damage that inflammation can cause. So that's a big thing. CBD also causes vasorelaxation or vasodilation, but simply put, in layman's terms, it opens up the blood vessels. So when it opens up the blood vessels, it helps to lower your blood pressure. So most of you know, under times of stress and worry and anxiety, it makes your blood pressure go up. So the more your blood pressure goes up, the more taxing it is on the heart, the more it strains your heart. So having CBD on board causes the blood vessels to open up, and it helps to lower the blood pressure. And CBD protects the heart structure from permanent damage, such as that which you would see with heart failure, and even what you would see in actual heart attacks. We discussed that the last time I spoke, how CBD has shown it will protect the brain and the heart against damage that occurs because of lack of oxygen. But in this case, with broken heart syndrome, it will also help protect from chronic or long-term damage that can happen as a result of the broken heart syndrome. So remember, I said that it is transient. So days, weeks, or months later, you usually will see that people who've had the issue, that their heart structure has recuperated and that their function is back to its norm. But what they also see is that there still remains some leakiness. There still remains some some instability to the structure of the heart, even after it appears that they have regained their function. There is still something there. So having CBD on board allows for the protection of the function and the structure of these organs so that we're hopefully not having to deal with long-term consequences. And so when we think about CBD and all that it can do, of course, we want to think about Wakana, the crown jewel of CBD, because at the end of the day, every single medical issue we can think of probably starts from some type of inflammatory process. I don't know how many of you really ever heard of broken heart syndrome or even thought that it was a real thing, but it is a real thing. So all the stresses that we have going on now, I mean, when I was researching all of this again, it actually made me stop and think, you've been under a lot of stress. How much damage are you doing to your body? So it's one of those things. I'm glad that I actually, my patient made me think about this, because this applies to me, this applies to you, this applies to everybody in this day and age, because everybody is under some kind of stress. And if you look at literature now, they will tell you, it will show that autopsies done on teenagers and younger adolescents, they will show that they have a mild degree of blockage that has started, which seems crazy, right? But no, think about all the stress that kids are under nowadays. Stress from parents, stress from peers, stress from teachers, stress, oh my goodness, there's so much going on with kids nowadays. But now we realize that the more they stress, the more danger their organs are of having some type of consequence from complications of inflammation later on in life. So we want to prevent that from happening. So what can we do? We can implement these wonderful products into our daily routine to give ourselves that extra measure of protection that CBD continues to prove it will give to people day in and day out. I continue to see more and more articles showing that CBD protects organs from the damage that can happen because of inflammation, the damage that can occur because of oxygen deprivation. And so let's look at the wide variety of products that we can get from Wakana. Wakana has products in all the businesses that are booming. So not only do we have products that are CBD related, of course, but we also have wonderful products in the skincare industry. We have essential oils, weight loss products, products for wellness and the immune system, and hair care products. The first products that we're going to talk about today are with our power line. So we do have a power line and a pure line, and that's because we want to make sure that everybody has an opportunity to use these products to protect their bodies, to give themselves a better quality of life, but we want to make sure everybody passes their drug screen. So if you are subjected to random drug testing, you want to stick with our pure line, and I'll show you something in the pure line in a minute. The pure line has as much of the THC extracted as possible. You get 0.0% THC in our pure products. Pure may also appear as broad spectrum when you look at the website. The power products, however, have 0.3% THC, which is the federal legal limit that can be in any and all CBD products. This is across all 50 states. So here we have the power line, and it's just to be able to show you all the different products that we can get in each line. So the first here, we have our tincture, the Power Hemp MD, which happens to be the strongest tincture that we have. These are drops that go under your tongue. We start off with 3 drops, let it sit under your tongue for 1 to 2 minutes, and it will get into your system in about an hour or so. The tincture then is followed by the Power Gummies. Our gummies are different from most because each and every one of them are infused. So every part of that gummy through and through is filled with CBD. So it's probably some of the most potent you're going to get. With our gummies, you want to start with 1/4 because, again, it is potent. And so you start with a fourth, and it will get into your system in about 4 hours, and it'll last about 8 to 12 hours. The next up we have is the premium flower, which is a smokable hemp. Now, it can be used as an herb that you put in maybe salads or a smoothie, but of course, the main way people use it is as a smokable hemp. Well, smokable hemp is the quickest way that that CBD can get into your system. It gets into the system in 1 minute. 1 minute. So if you're having acute cases of acute pain or a panic attack, anxiety attack, you definitely want to have a smokable hemp on hand so that you can quickly get the CBD into your system. And it'll last about 1 to 2 hours. And last but definitely not least is the Power Extreme Pain Cream, which I call my miracle cream, because across the board, 100%, it has been helpful to every single patient and customer that has used it. And when I say that, I mean, I have rubbed it on necks, lower backs, shoulders, elbows, carpal tunnel, knees, plantar fasciitis, and bone spurs. Every last person that I have allowed to put this pain cream on, they have felt so much relief that the next step was to buy the pain cream. So this, once you rub it on the area, it will get into that localized area in 5 to 10 minutes, and it'll give you some lasting results. Now, this has been different with different patients for me. I've had some who've had results for about an hour. I've had some who've had results with the pain cream for about 4 hours. So just see how it works for you. But what we do for people who have chronic issues, chronic pain, high blood pressure, chronic depression, we do something called layering, where we use all the products, because when one is working, and well, let me just go through this. Let's say we're talking about chronic pain. So we're going to put the pain cream on the area. We're going to take the tincture, 3 drops under the tongue, let it sit for about a minute, then swallow. And we're going to take 1/4 of a gummy. Well, what we know is that the pain cream is going to start working in 5 minutes, and it's going to last for about an hour for sure. When that is wearing off, the pain, the Power Extreme Hemp MD or any of the tinctures are kicking in. They're going to last for about 4 hours. But when they are wearing off, our gummies are now kicking in. And that gummy is going to last for about 8 to 12 hours. So if you do that twice a day, you have a consistency with the amount of CBD that is in your body, and it's the best way to handle chronic issues. Now, we also have a wide assortment of gummies, and the first up is our King of the Jungle, which is the major player in our sexual wellness line. When you're looking for something to increase your libido, your stamina, that will not drop your blood pressure, that will not cause you to have cardiac arrest like Viagra can, you're looking for the King of the Jungle. This has been just a great addition for so many of the men, because many can't take Viagra with other medications that they have, but the King of the Jungle does the job that they're looking for it to do without all those nasty side effects. Now, we call it KOJ for King of the Jungle, but it can also be Queen of the Jungle because it works well for both men and women. So we're boosting libidos, we're increasing stamina, we're changing lives of couples who are now having some more spice in their love life because of the King of the Jungle. Next up, we have the Flight Delta 8, which gives such great creativity, allows people to have more focus, allows them to just complete more tasks. Now, that caution sign on top is there because it is the closest that we have to the real deal. So it is legal. It is a cannabinoid that is legal in the 50 states, even though some of the states now are having some different rules and regulations as it pertains to Delta 8. So please make sure you're aware of your different state rules. But this is a product that will give you the focus that you're looking for. I have plenty of patients who have a diagnosis of ADD who are finding that using the Delta 8 is helping them to the point that some don't even use their Adderall anymore. Or as my office manager told me about one of her friends who's using this and is completing tasks, and she's calling her excited because she's able to do things that she wasn't able to do before because she would just drag and she just didn't have the motivation. Well, lo and behold, this Flight Delta 8 is giving her the creativity and the motivation she needs to get all of her tasks done. Here we have the Pure Gummies. Now, when you look on the site, you'll see them as broad spectrum. Pure and broad spectrum, they mean the same. But our Pure Gummies, that's the line you want to stick with if you have to do drug testing. But it will give you relief for what you're looking for. It will help you to sleep better. It will help with reduction of your stress and anxiety. It'll actually give you a boost of energy if you take it during the day as well. And then here again, we have the Power Gummies. We see here more of the smokables with the pre-roll and the vapes. Again, fastest way for you to get the CBD into your system. It is there in 1 minute using the smokable form of hemp. We have the SOS Hair Care system, which I absolutely love because it has restored my strands of glory. This is the real deal. If you're looking for something to give you stronger, healthier, longer hair, you need to be using this SOS Hair Care system. SOS stands for Save Our Strands, and it saved my strands. This pack comes with the shampoo, the conditioner, a leave-in detangler, a hair styling cream, and some oud body oil to give shine to the hair. But combining this with our Hemp Power Hair is phenomenal. So the Hemp Power Hair These are drops that you can put on the scalp, rub into the scalp, and let it do its thing. It's gonna revitalize or revive our hair follicles, make them healthier so that they can grow healthier, longer, stronger hair. And for men who are looking for that wonderful full beard, we have the beard and scalp oil for you. We also have some culinary products. We have some awesome seasonings that will add some flavor to your meals. We have the CBD butter that you can add onto your breads, but we also have some infusing drops here that you can add to your drinks. We have a full line of essential oils because, you know, Wakanda wants to make sure that we have products in all the different areas and industries that are booming. And we know how much essential oils are booming now. Great health benefits, but we have our own line of health of great essential oils that we know are going to be along the pure and high quality line that Wakanda is known for. And right now we have Flat Belly Lifestyle 2.0. Let me tell y'all, this is a jewel. Not only is Wakanda giving us a great products to use for weight loss, healthy, long-term weight loss, but they're also giving us the tools we need for long-lasting weight loss. So it's not just take a product, go on ahead about your business and lose weight, and then you know what happens after that, right? Without the right lifestyle modifications, that weight is definitely going to come back on. Well, that is not the desire of our CEO, Melissa Boston. She wants to go the extra mile. She wants total transformation. So not only do we have products that are going to help boost our weight loss journey, but she's also given us tools in the form of shopping with her at Whole Foods and her telling us what foods are good, what's not good, what to look for, but also an ebook with recipes, ways for us to transform our life, because lifestyle modification has to happen in order for us to truly be able to have lasting, healthy weight loss. And we have our Pure Seduction product lineup for our sexual wellness experience. We have the King of the Jungle here again, but also there's the Spot Lube. There is this edible Cherry Bliss cream, also body butter. We also have Spot Lube here spotlighted, which is a CBD lube, and the King of the Jungle once again. But don't forget, there could be like a little Q somewhere, because not only is it King of the Jungle, but also Queen of the Jungle. Helps with libido, helps with stamina, but you do not have to worry about your heart rate dropping, your blood pressure dropping, or your heart stopping. Well, you know, unless you're just having a crazy experience. But I do want to point out that the King of the Jungle does have that 0.3% THC in it. So while it is an awesome, phenomenal product to add some spice to your sex life, if you do have to do drug screens, we do want to say again, you want to stay away from anything that has the 0.3% THC. And so now for the legal part of all of this, our disclaimer: these products are not for use by or sale to persons under the age of 18. Our CBD vaping oil are not for use or sale to persons under the age of 21. The products should be used only as directed on the label. It should not be used if you're pregnant or nursing. Please consult your physician before you use it if you have serious medical conditions or if you use prescription drugs. A doctor's advice should be sought before you start any supplemental dietary product. And listen, the whole reason I got involved with Wakanda in the first place is because my patient came to me who was taking Wakanda products and told me how great the products were. And I could see it for myself, comparing her labs from a previous visit to that current visit. So don't be afraid to talk to your doctor about something that can really be life-changing for you, because these are products, I promise you, that have been changing the lives of my patients. They are living better quality of lives. And why? because again, most of what is going on in our bodies is due to some type of inflammatory process that is causing our organs to age faster and fail quicker. And what CBD is doing for us is it is such a strong anti-inflammatory that it is trying to block that from happening and keep our organs in the best conditions that we can possibly have them in. And so this concludes my presentation. I would like to say that if you are a guest on this call, you're one of three people. You want to support the person who invited you. You can go on their website and you can support them by buying products. That's person number one. But you might be person number two, and you might want to support by hosting a party, which right now, for sure, I'm sure that everybody who has invited somebody would be more than glad to have you host a party on their behalf. And guess what? You get some free product for doing it. But if you're person number three, like I was, when I heard that my first presentation, I was ready to start. Because for me, it was a no-brainer. I want to use these products because I for sure want to live a better quality of life. You know, at 50 years old, things start to not feel right. They, getting up and having a little back pain and the knees hurting more, or even just from the stressors from day-to-day life. So I knew I was going to use these products, and these products have truly been a lifesaver for me, because now when I lie down in that bed, I am going to sleep. I have a good restful sleep, a deep sleep, and then I wake up the next morning ready to go. But also on the wealth side, this is helping me to build a wealth legacy that I desire for my family. And Wakana has done it right. They give us all the tools that we need, all the support that we need for great success. So this is a win-win situation. So make sure you get with the person who invited you to this presentation. I hope that you have all been blessed by all that I've had to share with you. I am going to look now to see if I have any questions. Let's see. Hi, all of my folks out there from Louisiana. And thank you all for joining from all these other states. Hello. All right, let's see. Any questions? Yeah, stress is something else. I believe sometimes we think we're dealing with our stressful situations well, but we really are not. No. You know what? Let me talk about that just a minute. I'm not a freak out person at all. I never have been. I can remember ER nurses. I used to work in an ER, and I can remember some of the nurses commenting on, a person comes in with a, gunshot wound, or they're in cardiac arrest, and they're like, how do you not get all worked up about it? And, honestly, I think that's just the way God made me. I am not a freak out person. However, I started noticing probably about 15 years ago, maybe, that my jaw would hurt every once in a while. And the short of it all is that evidently when I get stressed, I clench my teeth and I bite out, probably because I'm trying to keep my tongue in my mouth to keep from saying something, but I clench, and what happens is I don't feel it and I don't even realize it when it's happening, but I'll feel it the next day. And so there are many situations where people think they're handling stress, they think they're doing well, but subconsciously there's an underlying issue going on that is causing them to have stress. I will tell you this, make sure that you have some very good friend, even if it's a counselor, that you're able to talk to and vent to. And make sure that you're checking with your family and friends and just ask them, how am I doing? And make sure that you're open to constructive criticism, because somebody that loves you needs to feel comfortable enough telling you, okay, you're looking like you're a little angry, or you're answering in a very aggressive manner, those are things that will let you know that you probably are more stressed than you realize. And it's getting that stress under control that will slow down the aging process, preserve the function of your organs, and help you to live a better quality of life. Now, as a Christian, I believe that we're not going anywhere until the Lord calls us home. However, what about the complications you're going to have to live with as a result of damaged organs if you're stressed so much that the inflammation in your body is so high that those organs become damaged? So we want to prevent that. I actually would. Somebody's asking about pseudotumor cerebri. Now, let me tell you, that is an increased pressure within the brain. So it's kind of like hypertension within the brain itself. Yes, that is an inflammatory process. Very likely, the tincture is going to help, because when you use the tincture or the gummy, its whole purpose is to reduce inflammation throughout the body. So that increased pressure within the brain potentially can be helped. Now, I haven't seen any studies that are specifically talking about the pseudotumor or the cerebral hypertension. However, just based on everything else that I have seen pertaining to the heart and pertaining to the brain, I don't see why it would not help. I don't see it being harmful, but I would talk to your neurologist about it or your internal medicine physician about it before you start. But it should, along with all other inflammatory processes, it should help. Let's see. Yes, Ma Mitchell, it is a real thing. It is a real thing. Oh, thank you, Miss Janine. Thank you, Miss Lou. Okay, I am trying to get to everything, everyone. Let's see. Thank you, Miss Louise. Thank you, Miss Margie, Miss Tijuana. Oh, look, my husband got on, y'all. All right. Thanks, Mr. Richard. Thank you. Thank you, Miss Candace. Thank you, Miss Eleanor. Thank you, everybody. Thank you. I'm looking for more questions.
Dr. Kim, there is a question in there about polycystic ovarian disease or
And
syndrome,
so, yes, ma'am.
PCOS.
And so, yes, ma'am. So same thing, definitely inflammatory. You end up seeing a lot of women because they're going to have an excess amount of fatty tissue. That excess amount of estrogen leads to, it comes from you having that extra fatty tissue. The more you have, the more inflammation you have. So if you think about postmenopausal women, there's a big controversy with hormones, because when a woman goes through menopause, if she starts to have really severe symptoms of, the hot flashes and the night sweats that are just, it's too hard to live with, then the next thing the doctor's going to want to do is recommend that they start on a hormone. Well, typically the next thing that happens is the woman is going to hear about there being more of a risk of heart attacks and strokes, because those hormones actually can increase your risk for heart attacks and strokes. Well, with PCOS, you have the irregularity with the hormones. You can get a whole burst of hormones right now. Lady might have a cycle, then she may not have any hormones for months on end, and then bam, there you have it again. The estrogen is going to peak, and you get the cycle again. So with PCOS, the bottom line is you still get these inflammatory processes that are forming. So the CBD potentially can help. And I actually have two different patients who are in their 40s, and They're seeing fertility specialists. And it's one of the things that I've been actually trying to research more because, they really want a chance at having a baby. And the fertility specialist has just said, nope. But I have been reading more and more about the inflammation that can happen in the ovaries as a result of PCOS, and in these women who are getting really, really close to menopause. But CBD is showing great, great promise in reducing inflammation in those reproductive organs and being helpful. Now, will it cure it? I can't say that. But I can say that it's definitely worth a try. And I know Dr. Rita has some videos out there, and you can probably check on YouTube with Dr. Rosalind Charbelt or Dr. Rita McGuire. And she has some different information, different videos about PCOS and endometriosis, different issues with the reproductive system where CBD has been shown to be helpful. Your outline of your processing your Wakana business, is that recorded? What do you mean, Ms. Jewel? I don't really know what you mean, but I can wait a minute and give you time to type it in. But hopefully this has been informative. Yes, broken heart syndrome is a real thing. Takotsubo syndrome. On the morning call, I talked. Oh, not recorded. Actually, I think that morning call was recorded, and I actually did see that Dr. Ross.
It is on the Facebook. Yes, it's on the Facebook page.
I saw that Dr. Ross did put it on there. Yes, ma'am. Okay, no more questions. And so thank you all for being with me this evening. Hopefully you gained some insight here. And I'm sure Dr. Roz is gonna have this recording on soon. So have a wonderful night. If you are a guest on here, please get with the person who invited you to this meeting, to this presentation, because Wakana has some awesome package going on right now, the new founding members pack, where you can get a share, potentially get a share of 1% of the gross revenue of the company, not gross profits, but of the gross revenue. So when I hear that 1% of the gross revenue, in my mind, immediately I think, well, that's a check all the time. That's, as long as we are meeting our criteria for getting a check, that is a check, as long as Wakana is in business. So we know that we haven't even reached the tip top yet. So we're continuing to climb, we're continuing to grow. The cumulative sales continue to skyrocket. And with all that they have going on now with the Weed Cafe and the other amazing things that are yet to come, you would want to have a share of that 1%. So make sure you get with the person who invited you to this meeting and ask them all about it and how you can get on board with being a new founding member. It is a simple thing to do, a simple way to meet criteria to get a share of that 1%. You just don't want to miss this once in a lifetime opportunity. So good night to all of you. Have a wonderful evening, and thank you for joining me this evening. I really appreciate all of you.